All right, so this is our project, evaluating community-based organization engagement in predoctoral dental education, strengthening partnerships to address barriers in special needs oral health care. All right, so a little bit of background about our project. Um, in 2024, Columbia University College of Dental Medicine started a new course for the first year dental students called Oral Health Considerations for Persons and Populations with Special Healthcare Needs. A key component of this course was for the students to separate in groups of about 8 to 10 and interview representatives from different local community-based organizations, local meaning around New York City. And essentially, they took this information and they presented it to the rest of the class. So, our goal of this project was to determine the barriers faced by individuals with special healthcare needs. Furthermore, we want to explore how to address them through the enhancement of both the D1 course and volunteer initiatives. So, we did this by first doing a literature review where we developed a semi-structured interview guide, and then we reached out to 13 community-based organizations and requested to interview a representative. So, in order to determine what aspects of the class could be improved upon and further explore the barriers to access and volunteer initiatives enhancement, we first needed to assess how the CBOs perceived the class. In the first figure, pictured up top, it demonstrates that the benefits of the CBOs that were believed to be a result of the participating of those CBOs that were participating in the class. So the percentages signify how many of those CBOs agreed that this was a benefit of the class. As you can see, one of the largest benefits that was reported is increasing student awareness of special healthcare needs related barriers, which is ultimately one of our objectives to determine these specific barriers are pictured in the chart below.
Okay, so this pie chart that we have here is the challenges, barriers that these community-based organizations, the individuals there were finding in accessing oral healthcare services. Obviously, the biggest one here is access to providers, but we also have dental fear, financial barriers, transportation, mobility, and stigma and discrimination. I think one of the biggest parts here, the key aspect, is access to providers is not just financial access and transportation access and the physical access aspect of it. It's also providers that are not having enough knowledge, they're not comfortable enough, they're not trained enough to treat these patients. So I think that's what makes the access part of it a little bigger.
So we also found that many organizations they believe consistent student volunteering can actually help address some of the barriers that we just mentioned by building trust or and reducing dental fear. And in the table here, I listed the types of volunteer activity each organization suggested. And three types of student volunteering came up most often, which are oral health education, general engagement with the special health care needs population, and initiatives to reduce dental fear. There were some limitations to our study. We didn't hear from every organization that we reached out, and we still need direct input from individuals with special healthcare needs and their caregivers. So, in conclusion, this project lays the groundwork for understanding what the special healthcare needs community truly needs from us. It also points us towards how we, dental school, can integrate those volunteer opportunities more intentionally into our program to enhance our education and to address those barriers faced by the special needs community. Thank you.